might be nice. I know we did. Great. Hi, Angie. We didn't have the opportunity just briefly to introduce ourselves, so that might be
Yeah, I would love
great.
that. Yeah.
And I'm Carol Reed. I work in the Needham Public Health Division since 2008. I've managed prevention grants. I'm grateful to have a state-funded grant that is regional. I work with the public health departments and stakeholder leaders in the towns of Dedham, Walpole, and Westwood. And we are very grateful to have funding for Nicole this year and next year. And our grant mission is to work through equity principles. And there are 8 guiding principles of equity and inclusion. And this is the foundation of our grant, where we are so committed to having Nicole guide our work, so we don't operationalize business as usual with prevention principles that often don't prioritize all people in the community. So I'll stop with that. That'll be my introduction. I'd love to just have people briefly introduce themselves, and thank you all so much for coming. Elisa?
Yeah, I'll go next. Hi, everyone. I'm Elisa. I've been working with Carol on this grant since December, which has been really great. I'm the coordinator. We've been doing a lot of cool stuff recently, which has been fun. I recently graduated from BU with my master's, which was exciting. And I'm excited to be here with you all today. Thank you.
Great. Nicole, and forgive me, I always say, being respectful of your time, Nicole prepares these workbooks and her bio is on page 3 and you can read. Thank you, Nicole.
Totally. Thank you so much. I actually wanted to get a quick, either a thumbs up reaction from who all was here last week. Any folks who were here last week? Okay.
I watched the recording.
Okay, perfect, fabulous. Okay, so the majority of folks, if you weren't and you didn't watch the recording, no worries. Just make sure Elisa has your email address and she can get that to you so you can check that out. So I just like to see who was in the room who has a little bit of the knowledge from the first session. So for today's session, I'm going to do a screen share here. Okay.
Great. Do you want to just have everyone introduce themselves?
Yes, actually, that would be nice just to see who's in the room. So I'm going to call Tiffany, Christine, and then Ellen. We'll start with you 3 first.
Hi, everyone. I'm Tiffany Zyke, one of the assistant directors of public health for Needham, and work closely with Carol and Lisa.
Awesome. Thank you.
Hi, my name is Christine Weitzel, and I'm a part-time clinician with Needham Youth and Family Services.
Great. Nice to meet you.
Nice to meet you.
I'm Ellen Worley, and I'm a clinician with Needham Youth and Family Services.
Okay. We'll do Angie, Alyssa, and Cindy next.
Hi, I'm Angie McDonald, and I work in prevention and Needham Public Health.
Okay.
Hi, my name's Alyssa. I work with Christine and Ellen. I'm the admin assistant over in Youth and Family.
Okay, great.
Hi, I'm Cindy Melanson, and I work with Needham Public Health, and I'm working with the accreditation team.
Oh, wonderful. Wow. And then Julie and LaTanya and Trish.
I am Julie. I'm an epidemiologist working in the Needham Public Health Division.
Oh, great. Wonderful. I'll be looking to hear your thoughts and perspectives on the content today. We're talking about data.
Hi, I'm LaTanya. I'm the director at the Senior Center, and I work closely with the whole Needham team.
Okay, wonderful.
I think I'm up. I'm Trish Foster, and thank you so much for including me. It's fabulous to see all of you virtually and be here. I am a DEI consultant, a change agent working to make organizations more inclusive. I work with a lot of organizations actually in Massachusetts as well as across the country. And I am collaborating with Nicole on quite a bit of work at this point. Great to be here.
Awesome, awesome. Great. Well, thank you all for being here today and for your time and attention. All right, so today we are focused on what I call data and equity. As Carol mentioned, my Bio is provided for you. I will say, if you have your phone handy, if you show your camera to the QR code, it will actually give you access to my social media. I use LinkedIn a lot, so I always encourage people, if you are on LinkedIn and want to connect, it's always nice to make new friends and make connections in that space too, so feel free. I also like to start my sessions by just centering us into the content. I know for me, the way the world has been working is there are back-to-back Zooms. We've forgotten things like travel time and brain space in between meetings. And so I like to usually take just a few moments at the beginning to center us into the conversation, our time together. If you have the workbook, this is actually an activity already in there, but if no, no worries. You just grab a piece of paper and something to write with, and you are going to create a quadrant on your paper, okay? Cross so that you have 4 quads. And there are 2 things I'm gonna have you do. I'm gonna first have everybody draw a little spiral right in the middle, and I'll give a time for that. And then I'm gonna ask you 4 questions. Your goal is just to write your thoughts in these 4 boxes all around the topic of today. You won't share it with anyone or anything like that, but it's just to kind of center you towards what are we going to be talking about today. So I'm going to set the timer for just 30 seconds, you all, not even that much time, to give you an opportunity to do some deep breathing and to draw your spiral right there in the middle of the page. Okay, so I'm going to press start and you can go. Do make sure you're actually breathing and not holding your breath as you do this. Okay, so our first question in the top left corner. When you think about data, what comes to mind? When you think about data, what comes to mind? All right, your second question. What fears do you have about prioritizing equity? What fears do you have about prioritizing equity?
Nicole,
Yes.
mine doesn't say that.
Oh, what does yours say?
What fears do you have about working with data?
Oh, thank you. We'll use that one. What fears do you have about working with data? Thank you. Sorry, Carol. I must have a different question saved on my notes here. Thank you, Carol. So what fears do you have about working with data? And data can be nerve-wracking. And then our third question, to make sure Carol's got the right one. She's got our book here. What do you think is our biggest potential for change? Carol, you mind confirming if you've got the same question in yours? I think that one's right.
Mm-hmm.
Wonderful. Okay. What do you think is our biggest potential for change? And this is around using and leveraging data, you all. All righty. And then our last question is, what are you hoping to learn from the workshop today? What are you hoping to learn from today? All righty. Okay, so let us get started here. I have 3 primary objectives. One, to kind of share the power of data for good. How do you use the power of data for good versus amplifying bias, which is what happens sometimes. I want to define what data literacy is, help us really understand how to be great consumers of data. And then I want to talk a bit about how do you construct an equity-focused needs assessment, because it is my belief system that data should guide all of the work we do, and that begins from assessing our needs. So in our first objective, I want to share this quote here. It says, data are just summaries of thousands of stories. Tell a few of those stories to help make the data meaningful. Okay. And I think sometimes I like to remember that data represent people, real people, you know, and how do we amplify the stories of folks so that it's meaningful and that there is contribution to society and the communities we're helping and serving. Now, in our first session, I introduced this tree to you all, and we talked about how you can have 2 types of communities, a community with high assets where the community is able to thrive, which is the tree that you're seeing on the right, despite there being health issues. And then the tree on the left is a community that has higher inequities. And as a result, sometimes the community can struggle to really survive and thrive. And what I want us to think about today when we're considering data is, where are we collecting our data? Is most of the data we're collecting symptomatic and just looking up at the top here at things like, oh, how much are people smoking, or how much depression's in our community? How about obesity? Or are we really beginning to look at the other parts of data? Do we have any information around the social determinants of health, the level of poverty, access to schools, access to health insurance? And so one of the first questions I want you all to think about here is, as you collect data on the communities you serve, where are you collecting most of your data? So this is our first opportunity to use Mentimeter. It's a survey tool that I use throughout trainings. This will give you the ability to anonymously respond throughout. So you can do it 2 ways. You can use the camera on your phone, and that'll drop you right into Mentimeter. Or you can actually pull up a new window that's menti.com and put in this code here. And this first one is just a slider, and all you do is you say, are we collecting data on the individual, structural, or systemic level? And this is thinking about that tree there. And so I'm going to go back over here to our Menti to see, as people vote, where do you think you guys are collecting data? Is it yes or no? Is basically all you're answering here on this one. Are you collecting data on just the individual level, which is like the symptoms of things in your community? Are you collecting some structural data? Or are you beginning to think about the root of some of the health issues that your community is experiencing, or the disparities that your community is experiencing? So
Nicole,
this is
can I
great.
interrupt?
Yeah, please.
Sorry about that. Can you for one moment go back to that other slide?
Yeah, the tree.
Just so I need to grab that, the one that gave us the access to the Mentimeter.
Oh, yes, yes, yes. No problem. It's right here. There you go.
There it is. Awesome.
There you go. I
Thanks.
might have taken it away too fast.
Yeah, yeah, I'll even put, I don't know if everybody else needs it, but I can even put that code in
the chat. Perfect, perfect. That'll work. That'll
okay,
work.
great. Thank you.
Okay, so this doesn't surprise me. Often, a lot of the data we collect, you all, is just on the individual level. I am very, very happy, though, to see that there are folks saying, you know what, we're looking at some of the systemic and structural issues that are creating these health outcomes, and we're beginning to gather data on this. And this is what I want you all to kind of keep in the back of your mind as we think about data. Are we collecting a comprehensive picture of why certain issues are happening in the communities we serve? I think that becomes the true root of doing equity work. And I want to say, you know, just as Trish hopped in here, if anything comes up, you have a thought or a question, feel free to ask, to stop me, to put your voice in. I'm always open to direct conversation. So I want to think about here this concept of data equity and data justice. And what do we mean by these two terms? So first, I want to define what both of them are. And when we talk about the concept of data equity, equity really begins to capture the complexity of ideas, this lens that, you know, we have a history of data and research not always interacting with populations in the best way. Okay. And so when we're thinking about collecting data, we want to really make sure we're doing it in an equitable fashion, the collection process of it, making sure we have a representative sample, all of the kind of good nuggets of what it means to really be equitable in how you're doing this work. But you also want to think about how are you analyzing your data? How are you interpreting it? What is your distribution of your data into the community? Do you actually communicate back to folks? Because something you'll actually hear people talk about is research will come into a community, ask for all this rich data, and the community never hears again. Okay, so then it becomes, well, what was that about? Was that just a research project? Was that just your dissertation work? Was that just your grant initiative? And so we've got to really start thinking about this and having a greater responsibility when we're using data. And data equity pushes us to consider the ways that data can reinforce stereotypes or exacerbate problems, right? One of the biggest ways I like to think about this, you all, and I talked about in the last session, is this concept of a disparity. And what has always been challenging for me is to recognize that disparities are preventable differences in health outcomes that are based upon things like race, ethnicity, socioeconomic status, or geography. Yet, disparity data is presented as if this is how the community is. And that is the challenge that we've got to start unlearning with how we present data. That when we present disparity data, we really should be thinking about also the equity part, which is to say, why is the disparity happening? We can't just present that it's occurring, okay? There's typically something deeper, and usually it's an inequity that's occurring in the community because of lack of access, right? And so how do we bring that up? And to me, that's connected to some of the conversations around data justice. And so this begins thinking about what are our ethics around how we use data, what we use it for, how really data can be a place of power and privilege, okay? Because for those people who know how to use data right, you're able to, you know, have conversations with your local politicians, to have conversations with, you know, people who have funding, right? And you're able to say, hey, because of this data, you know, we meet a need and there's a need here. How can we get additional funding? So data becomes power too. And I think it's important to kind of think about and realize that there is a justice piece in the data here, which is all kind of tied to our ethics.
Nicole, can I jump in again?
Sure.
Could we pause for a moment and say, what do we mean collectively in this group when we talk about what justice is?
Yeah, I love that question, actually. Yeah, because if we're thinking about the communities we serve, what do we actually mean by justice? And I'd be curious, what are some folks' thoughts around what justice means? And if you feel justice has a role to play in our work.
So I always, since I'm the one who asked the question, I'll get it going. And thanks for letting me sort of be provocative for a minute. And I also don't want you to lose. I know how it is. I know you have a lot to cover in a short time, but it's sort of weird because I always include something about justice in my work, as you know, but I often get challenged, and the other day. I got challenged again. And it's, so I always say, so it's fixing the system to take care of inequity.
Yeah.
Right. So
I
that's
love that definition.
fixing the system.
Yeah. You know, I think sometimes people get nervous with terms like justice. And I feel, and I think the beautiful part about being in the field of public health is we are allowed for conversations and concepts of justice to naturally be embedded in what we do because of what public health is, at least to me, the tenets and ethics of public health. At the same time, I do think we don't talk enough about the justice part of our work, you know? But I'd be curious if anyone else has any thoughts on this. Carol, I see your face. I know you're muted.
I'm muted for a reason because I always talk too much. So I want other people to talk.
It's okay.
And I'm going to be honest, maybe my viewpoint coming from having many, many attorneys around in the family, I think of it as more justice as fair and equitable treatment. And I don't know why, but it is for me connected to some sort of like legal structure. And maybe that's because I'm not a public health, like when you talk about it in public health, yeah, that's like a different concept. I mean, I think there's justice in terms of everyone being able, like we talked last time too. I love that sort of equity and accessibility being a fundamental component of it. When we did the bicycle graphic and stuff, you know, that sort of concept. But to me, it's another sort of systemic system. It's a justice system that oftentimes, you know, perpetuates inequality and perpetuates unequal access to things.
I do like that. And I like that perspective, actually. I had not thought about it. When you started to speak about it from that side, I was like, oh, that's right. That language in law, it's justice, right? Law enforcement, there's a whole nother world where the word justice does conjure something a bit different than even I would say how I'm using it. So I really appreciate you bringing that up because I do think there's a component of law in there and system stuff too, you know? So thank you for that. Latanya, you got your hand up.
I did. I was going to say it definitely has like a legal to it, but I also think data, it's kind of tricky. We collect all the data, but sometimes I think it's not fairly collected and not fairly distributed as far as the responses we want to get. Like for example, we do a survey, meanings to a different minority may mean something else when answering a question. So I think it all kind of ties together, making sure the data you're trying to collect is represented fairly and equally to get to the results that you're looking for.
Yeah. I totally like that. And I think that kind of links to this very next quote that I have here, which is thinking about our why. Like, why should we care about equity and justice in data? Well, it says, right or wrong, research can drive decisions. If we do not address the power dynamics in the creation of research, at best, we are driving decision-making from partial truths. At worst, we're generating inaccurate information that ultimately does more harm than good in our communities. This is why we must care about how research is created, you know? And so really just thinking about that piece there for our, folks who really dive into the data side of things. So I want to talk a little bit about what I think is the beauty and power of data. One, we can use data to count and to describe the disparities that exist in our communities. And as a result of doing that, we also are able to count and identify opportunities. Because again, if we remember that disparities are connected to inequities, to me, that just gives us a lens of, wow, here's an opportunity we have to make a change and to fuel policy action and advocacy. Because with the right data, you can truly move mountains in a community. I've seen it happen. I think we're all living it, right now as our world is actively changing. So I want to share with you just a short little video clip that comes from a group called the City Dashboard, a City Health Dashboard, and I will drop their link here in the chat. This is a resource that I have come across most here just recently, last several months or so, where they talk about this city dashboard, which my work focuses a lot on substance prevention. So I was a little bummed that they didn't have that. They hardly had any substance prevention measures, but they have a lot of great measures in the social determinants of health space. So you might find their dashboard helpful, but I would just want to show you this video of an example of how a community used data to make some significant changes in the work they were doing. Oh, sorry, it must be muted. There we go. Hold on.
Meet Donna. Donna works with a community coalition that aims to increase health equity in Pawnee, Indiana. One of the coalition's goals is to increase access to healthy foods for Pawnee residents. Donna goes to the City Health Dashboard to explore Pawnee's data. First, she identifies which neighborhoods are most likely to lack access to healthy foods. Next, she examines the data by race and ethnicity to see how different groups are affected. Ready for action, she finds programs that she can tailor to Pawnee. Thanks to the City Health Dashboard, Donna and the coalition are now empowered with tools to move from data to action. Move from data to action in your city with cityhealthdashboard.com.
Yeah, now I don't know how many of you had actually heard of the City Health Dashboard. I had not come across them before, but truly their website is actually really nice. You can put in your zip code and really look at multiple measures across most of the 5 domains of the social determinants of health and gather a really comprehensive picture of what does a community have access to. And then the idea is that you're able to take that and use it either towards like community development block grants, maybe some foundations or funding opportunities to reallocate resources. So I like to share it. Again, if you're focused on the substance stuff, you probably have to pull on more of your own data that you collect on substances, but it's a really nice way to get a picture of some other things too. Now, do you all in Massachusetts have a dashboard that helps people kind of look at what's going on in their community?
Nicole, that's awesome. And I just wanted to say the folks here know and that the intersectionality of those determinants and substance use and mental health. So even though you're saying it doesn't have the opportunity to put in, I think you said the substance, there's not a lot on there. There's enough research that shows the overlap.
Right. That is very true.
With heart disease and substance and vice versa. So I just wanted to say that. And the answer that I have to do we have this in Massachusetts? I have not seen it and I don't know. So maybe somebody like Tiffany knows more.
Okay. Well, I will say of the substances they do have, they've got opioid deaths, smoking, and binge drinking as the 3 measures that they actually provide on the city dashboard, but nothing more comprehensive than that. Nothing on youth. But again, like you're saying, Carol, if you're collecting that data, we know enough for what crosses over to be able to say proxies, indicators, things like that. So I think in combination, it's a great tool to add to your data toolkit.
So there are several different data sets, none that's comprehensive for all
Okay.
Massachusetts. There's a couple of nonprofits that do websites for food insecurity, whether or not they're in a food desert, that kind of thing. There's a couple other
Okay.
sites that do specifically for substance use, but there's not one quick stop shop for a
I
lot of
see.
these things.
Okay.
You do have to piece and pull several
Okay.
of them together.
So that might be an opportunity for 23 or 24. You know, we can gather some funding resources together and the right crew of people and potentially create a dashboard for the state. You know, who knows? It might even be interesting. I wonder if City Health Dashboard does any work with states. I've been seeing some data companies who work with states. My Sidewalk is another one that does dashboards for states and things like that. So that's cool. Thank you for that update, Tiffany. I appreciate it.
I'll tell you, I'm going to say one more thing. Julie McCarthy, who we were able to hire, Julie, as an epidemiologist through ARPA funds. Someone like Julie, you know, worked so hard for us through, as Tiffany said, pulling data from all sorts of different places and actually like asking 3 times from people that you'd think would be really willing partners through ICD codes in the hospitals. But it was in the Globe, Monday, that our legislature is still discussing what they're going to do with $2 billion in ARPA funds. Yes, we're one of the slow ones. So wouldn't this be a great project?
Wouldn't it be a great project?
I do find that it is very difficult to get data, you know, for youth and adults in Massachusetts. Really hard.
Okay.
So that was
good to know.
might be
Thank
an
you for
idea.
that. Yeah, I love it. I love it. We can definitely talk more because there's some really great resources out there. So I always like to think, right, with great power comes responsibility, okay? And truly to kind of think about the other side of here is what is the burden of power when you're thinking about data? And the main one that comes up for me is survey tools and thinking about the potential for inequity. There are a couple ways this happens. One of the easiest way it happens, you all, is literacy level. If you think and consider, you know, the literacy level of the community you're serving, you want to really make sure that your language on the survey questions are at a level that your audience will understand, because that can skew things for you. So really kind of be thinking about how you do surveys, the way that the methods that you use, right? That can vary greatly. Some people, you know, are okay with the newest, latest technology around surveys. Other folks might need pen and paper. So for some folks, pen and paper is not good. So you really want to know your audience, because without knowing your audience, the survey tool you use itself can create inequity, and that can be a challenge. We also want to think about it. This was mentioned before, you know, like how accurate is the pool of folks that you've pulled to survey in terms of representing the audience that you're talking about, you know? And this can be the challenge too. Do the demographics of your survey respondents actually reflect the demographics of the community that you're serving or the community that you're wanting to find out more information about? And did you survey enough people to even make a statement about what you're saying? And so something I remembered when I was in grad school and doing stats and data and all this good stuff, I started learning about things like the N number and p-values. And this is me being, you know, a little bit geeky, but the truth is, you all, the regular everyday person, the coalition folks, people who you share data with, they don't know anything about that. And so it becomes our responsibility to communicate effectively and to not make statements that are, you know, not to create narratives that are unfair. And so I'll see stuff like where people want to make a huge statement and the number of people they surveyed was like 30 or 40. And it's like, well, is that enough people to have surveyed to make a statement about this? And so just remembering, like, when we're creating our narratives from data, we can amplify bias, we can push forward the wrong narrative when we are sharing data in an irresponsible way. So I think it's always important for folks to kind of think about that and recognize that. And that burden is on us, because again, like I said, your typical everyday person who's hearing you say, 4 out of 5 of our students XYZ, they just trust what you said. Because they don't know anything about the data, right? So just remembering that kind of responsibility in this work too. All right, so I want to talk about data literacy and what it means to think about data literacy. There are 3 main components with data literacy: how we read data, how we work with data, and how we communicate with data. These are the 3 main things that kind of make up literacy. And so when we're reading data, I think it's always important to remember that uncertainty is inevitable. Just like I was saying that, for a community member to hear data from us, they trust us. It's important for us to remember when we are looking at data reports or looking at the information that comes, to understand that data is just a picture, okay? It's a lot of times a speculation. Unless you've got some really robust data sets that you're looking at, there's always going to be a little bit of uncertainty there when you're reading data. So I always say, have a skeptical eye and a skeptical mind when you're reading and reviewing data. Because you want to make sure that the folks who are sharing the conclusions that they've gathered from the data have answered enough questions, they've dug deep enough to truly know. If you remember the tree, right? We want to be looking at data that not just shows the leaves, but gets all the way down to the roots. And so you want to take that same perspective. When you're reading data, you want to say, is this just the leaves? Or did these researchers look a little bit deeper into this and truly kind of dig in to find out why this particular issue is happening? And so I have a video I want to share with you all that I think does a great job of articulating why it's important to ask multiple questions and as many questions as possible when you're attempting to discover why a situation is happening. And this is a true story taken from the monument and the Jefferson Memorial in DC. Okay, so I love that one, right? To think about, have we stopped asking why too soon in our process? And then if so, are there interventions and strategies we've done that were helpful only to a certain degree, right? Because imagine if they'd stopped at the first one and actually moved the airport. That wouldn't have helped too much, right? So I love that video because I think it does a great job of helping us to think about when it comes to data, are we asking enough questions? And I say when you're reading data, really kind of think about, did the researchers, to your opinion, ask enough whys to really help them understand the nature of the problem? Okay, so the next part is the working with data. Now, when you are working with data, there's two main types to think about. There's your primary data, which is the data that you collect originally. Okay, and then a lot of us do a lot of work with secondary data. This is data that other people collect that we use to help us guide our research and our work that we do. There's two main types of data. There's your quality or qualitative, right? This is the descriptive type of data. A lot of times you'll get these data from interviews, focus groups, that sort of thing. And then you have your quantity or quantitative data. This is typically your numbers. This is your counts. You're able to say, oh, of our community, 30% XYZ. That really gets to the quantity, the number and counts. I do believe both are important for creating a comprehensive story. And then lastly, when you're working with data, you really want to think about the richness of the sources that you're using. If you're pulling from secondary data, have they done a good job in their research methods? And if you are gathering your own new, fresh primary data, you really want to think about your sources now become, who did you interview? How representative is that sample of the population, right? These are the types of questions you want to ask because you're going to take that data and create a narrative. So you want to make sure you're creating the right narrative. And that's all back to the sources that you choose. Something interesting to kind of think about when we're talking about data collection, there's been a lot of conversation about how do we disaggregate our data. There's a statement here from the Annie E. Casey Foundation, which they are amazing. And it says, the kind of data collected matters and can help unearth a problem masked by aggregated data, even data already broken down by basic racial categories. And so what this is saying is that as we collect data, and if we're really going to focus on equity issues, we've got to look and disaggregate and analyze our data differently. We have to actually be able to see the people in the work. Because sometimes when we just group everything together, you're not able to see that there are actually some disparities and inequities happening. And so there's a lot more conversation looking at this work here of disaggregating data. I know most recently I was helping a community do a DFC grant, and the community wanted to focus on BIPOC students. However, all of the data that the school had publicly displayed was by gender, and it was by age group, like grades in school. And so they had a really difficult time beginning to assess a problem that they really felt was there because they didn't have the data and the school wasn't disaggregating it. Now we know the school collects demographics on students, but when they do the report, it's by 9th, 10th, 11th grade, and it wasn't disaggregated in a way that they could actually see, well, even though this is happening, we're seeing greater risk amongst our, for instance, Latino students, and they couldn't make those statements. So disaggregating data, I think, becomes really important as we're focusing on equity and creating that space for folks. The last component of data literacy is how we communicate with data. And this just reminds us once again that we should be communicating that uncertainty is inevitable, that our statements aren't typically causational statements and things like that, right? And that we are responsible in how we share the information so that people know the limitations, right? To say, hey, here's the trends we're seeing, but there's no guarantees here. There may be anomalies. This is based upon the data that we collected from this demographic of people so that folks really know. And I think to me, the biggest component of communicating with data is the responsible part, making sure we're using our data again to push forward good in the world and not amplify bias. Okay, so those are like the three main things around data literacy. The last thing I'll say around communicating data is I've most recently really got into things like data visualizations and infographics, and how do we make the actual consumption of data easy. Okay, so often, I don't know if people go to conferences, especially conferences with educated folks, we have a tendency to have these slides with like 15,000 words and bar graphs and all sorts of stuff that's like, I can't even see what's going on the slide, you know? And so for me, how we communicate with data also means, how do we bring the literacy down so that someone can easily see, oh my gosh, this is what it looks like, in a very clear way versus a way that, you know, just has your audience glazed over. So I always think if we're going to talk about equity, you all, we got to be thinking about how do we leverage visualizations, how do we leverage animations, different ways of presenting our data so that the community actually sees and understands what the situation is, and they can be an active part of the advocacy work if they truly understood what the data was saying, you know? And so just thinking about that, again, these are the three main pieces that encompass data literacy: how you read your data, how you work with data, and how you communicate with data. Okay, any questions on this? Okay, cool. Carol, I see you breathing.
Excellent.
Excuse me.
I have a question.
Yes. Mm-hmm.
I'm just wondering if you could talk a little bit, and it probably could be like a whole nother topic, but the issue of sort of understanding data sources and recognizing their bias. I feel like it's so difficult, whether it's, I mean, the KC Foundation is one thing who, you know, has a sort of established track record, but I feel like even like, say personally, like I'll be on my, you know, Twitter feed or whatever, and I'll see, oh, this research study came out, this came out. And it's so difficult to know. I feel like everything these days is so politicized and so, you know, coming from a specific bent, and like how one can really decipher that. I mean, I know that you can go somehow, if you can find the actual like research, you can kind of dive there, but is there any other tips you have for helping to understand and like critically analyze the source of the data?
Yeah, my best advice is I've gotten really, really picky about who I accept data from. I really do. Because of that very thing. And with the advent of the internet and the social world, there's a lot of data that comes out all the time. I mean, we saw it in COVID, in the pandemic. Okay. There's all sorts of stuff that comes out. So for me, I really look for, like, honestly, I look for .gov is my, but that's because I'm public health. So I look for .gov. And then after that, I look for research, which there's a whole other access equity space there too. I look for big names, Johns Hopkins, Harvard. Like for me, Boston, I've become very, very select with who I look to for data, my health departments, things like that. And most recently, when it comes to when I access data, I actually have a My Sidewalk account. And so they pull data sets from all across the country. They've already curated them. So I go in there and poke around and look for data. But it's really challenging. This is the biggest issue because almost anyone can say, I have a data set, and present it and share their thoughts and perspective. And it's hard when you are just a regular everyday consumer and it's coming at you in all these places, even in your social media now, news, like all these avenues present data. And for me, I have not found it helpful, honestly. I know that doesn't help. Or maybe it does a little bit.
It does. Thank you. I appreciate it.
Okay. Yeah, you're welcome. You're welcome. So the last thing that I want to share with you all is just thinking about equity. We've got like 8 minutes left. So I am so sorry, but we had some great conversation at the beginning. What I'm going to do is just share with you all this video. The video is about 6 minutes long. It does a great job of summarizing everything. So I think I'll save my words and show you the video instead, and let this be what you marinate on as we begin to take our exit.
We live in a world that is increasingly defined by data, but how we portray this data impacts the meaning. How would you feel if you were one of the data points in this visualization? The colors, labels, icons, and words we use are critical elements of our data stories. We need to take a closer look to ensure that our data stories consider the context of the incredibly diverse world that we live in. To be fair, to be credible, we must have sensitivity for our subject matter and our audience. We must be intentional and empathetic, guided by the most fundamental principle of all: that data points represent real people. Picture this. Doing good data means doing no harm. As data storytellers in a data-driven world, we have a unique set of responsibilities. To ensure that our analyses are trustworthy, we need to hold data up to close scrutiny. We need to ask hard questions as we gather information and apply rigor in our analyses. The Do No Harm Guide from the Urban Institute addresses the responsibilities we all share in using data responsibly to further the cause of equity in our society. Let's take a deep dive into these 10 recommendations from the Do No Harm Guide and learn how to represent data through a more diverse, equitable, and inclusive lens. Number 1. Critically examine your data. Before you begin your analyses, consider the context of your data. Equity awareness begins with gaining a holistic understanding of the story behind the data. Where do your data come from? Who is included and excluded from it? How was it collected? Why was it collected? And who benefits or who is harmed by these data? Number 2. Use people-first language. If your data is about people, make it extremely clear who they are. Remember that data shown reflect the lives and experiences of real people, and lead with the person, not the characteristic. In visualizations, labels matter. You should strive to use people-first language. Consider people with disabilities instead of disabled people, or people in prison instead of inmate. Number 3. Label people, not skin color. Language is living, breathing, and ever-changing. It's only logical that certain labels that may have been used in the past are no longer acceptable, and may in fact be offensive. In your data analyses, the best approach is to use full labels such as black people, not blacks. Number 4. Labels and their hierarchy have meaning. Who is shown first in a table, graph, or visualization? Order conveys a hierarchy and can influence the way your audience interprets the data. To avoid perpetuating historical biases in the way your data is presented, consider alternative sorting techniques such as study focus, specific story or argument, or quantitative relationship. Alphabetical order or sample size works too. Number 5. Consider missing groups. It's important to acknowledge who is and who is not included in our data and charts. For example, in the United States, many charts on race and ethnicity only show white people, black people, and Hispanic or Latino people, but not other racial or ethnic groups. Charts sometimes only show data in these broader racial groupings, rather than at a more disaggregated level where nuances are more readily understood. Consider adding notes that explain why the data are not inclusive or representative. Number 6. Use color with awareness and care. The way we use color can inadvertently reinforce stereotypes and perpetuate inaccurate depictions of individuals and groups. To use color with the best intent, check your choices. Avoid using colors associated with stereotypical gender labels. Pink for women, blue for men, for example. Colors associated with skin tones or race should also be avoided, such as light to dark or incremental color palettes used to indicate different demographic groups. When used appropriately, color is a powerful aid in data visualization. Lacking awareness, we risk creating misperceptions and offending our audiences. Number 7. Consider the impact of icons and shapes. Icons, by their very nature, are intended to convey broad meanings, but they can perpetuate harmful and offensive stereotypes if used carelessly. These elements must be chosen with care. It's essential that any and all stereotypical, discriminatory, and racist imagery is avoided. It's also important that images depict people as empowered and dignified. It's never acceptable to use imagery that depicts people as helpless victims. Number 8. Reach out and connect with the people at the center of your research. To tell relevant and impactful data stories, data communicators need to be empathetic. Building relationships with people and communities that you're researching is fundamental, and maintaining these relationships is just as important. You should do research and analysis with communities, not on behalf of them. Buy-in from members of the community, policymakers, and other stakeholders helps research be more impactful, relevant, and embraced by a wider audience. Number 9. Reflect lived experiences. Not everyone has the same life experience. Our individual characteristics such as ethnicity, gender, and neurodiversity, and age deeply impact the way our research takes shape and form. Consider what your work may be missing and seek out colleagues in communities to help identify them. Number 10. Understand the needs of your audiences. The value of your data lies in how well it can be used, shared, and understood by your intended audiences. As a data communicator, you're responsible for ensuring that your content is clear, unambiguous, and useful to your readers. This requires due diligence across every aspect of your work, striving to ensure that word choices, terminology, and even the languages that you publish in are fully optimized for your audiences and mindful of their needs. As people who are experts in the field of data science and data communication, we're in a position to improve how people view and understand race, ethnicity, and other aspects of identity, and make positive contributions to every aspect of society and culture, from how policies are created to how products are designed and built. We must lead by example, and we must do no harm in our data storytelling. Our point of view should be grounded in principles of equity and fairness. If we fail to do so, we will reinforce damaging stereotypes and mischaracterizations. Or worse, we contribute to the narratives that lead to deeper stigmas and cultural divides. To learn more from leading experts at the intersection of data and equity issues, and to download the complete Do No Harm guide from the Urban Institute, visit the Racial Equity Data Hub.
Okay, so that took us right up to the end. What I will make sure of, you all, this is an excellent resource. I'll make sure, Elisa, to send you the link to the guide, because I realize it's not in I don't think it's in your document, you all. It's a wonderful resource for really diving deeper into this. I do apologize for taking us right up into the last second of our time together. This has really been a great conversation. I realize we don't have any time for a further discussion, but what I'll do, I'll add a little bit more time in our time next week.
And I just wanted to remind people, and we'll be sending an email. First of all, thank you. And next week, our last session, our third session, final session at this point, will go from 1 to 2, and we'll send out a reminder on that. But thank you all for joining.
Thank you all. Thank you all.
And
I'm going to check the chat to follow up on some stuff with you guys. Okay.
Thank you.
Thank you all. Have a great day.
Thank you. Nicole. Bye, everyone.
Okay. Bye, y'all.
You have to go?
No, I'm good.
Okay.
Yeah. Man,
It cracks me up how people are like, oh, I